Now we have the honor to interview Dr. Makaroun, a very well-known endovascular specialist. We will have the opportunity to know his opinions about these very interesting topics. Dr. Makaroun, which is the future of endovascular therapy? Where are we going now?
Well, the future of the endovascular therapy is what we have been doing for many years, which is pushing the limit and advancing the indications to more and more areas of vascular disease. It's also trying to perfect the results and improving the technology to get to the point where we have very durable outcomes, which rivals, if not sometimes betters, the results of the traditional open surgery.
So we have a problem of indications, we have a problem of materials, we have a problem of costs. Which is the main problem of the endovascular therapy nowadays?
Well, all of these are very important issues that we have to deal with. Clearly, costs is one of the problematic areas of endovascular therapy because the development of new technologies is very costly and the distribution, unfortunately, prevents access to endovascular therapy among a lot of healthcare delivery systems that cannot afford this expensive technology. The indications is another issue. Sometimes we start focusing on lesions rather than focusing on the patients, and that occasionally leads us to apply the technology in areas that may or may not be appropriate for it.
And referring to symposiums, to meetings, we have been seeing different kinds of meetings, different kinds of symposiums. Which kind of meetings should be in the future? Which play should they be in the future? How should they be? These living cases, or in these pro-contra sessions, or with long talks? Which is the most interesting kind of symposium?
Well, as you mentioned, meetings are quite different in the way they are structured, but all of them are very valuable in delivering an improved outcome to our patients. The society meetings clearly expose us to some hardcore data that is very important for us to properly apply our different technologies to the patients. Symposia such as the Society here really has another very important advantage, which allows top-notch specialists from around the world to gather together and share ideas and compare results from different parts of the world. Live cases is another issue because that's probably one of the best ways of diffusing new techniques. It's very hard for all of us to travel to one site to try and learn from what one individual may have find as a better technique to apply to certain patients. So when we can actually take it to a big symposium that delivers live cases, that's another advantage to this. Although there is clearly some ethical issues regarding the production of live cases, but most of them are done extremely well in most parts of the world. So I do not believe that we should have just one type of meeting. I think they're all very valuable, but probably these types of symposia are some of the most valuable for the practicing surgeon who can go and listen to a variety of specialists from different backgrounds and different parts of the world and be able to really gather a much better synopsis of where technology is heading and what is the best way to apply to different patients.
Mm-hmm. And referring to meetings, to symposiums, now we are presenting in endovascular TV. What do you think about it? You feel it interesting?
Yeah, this is a very novel idea. Actually, I was not aware that it existed, and it is very exciting for me to be part of it. I'm definitely going to go and check it out on the internet as soon as I'm done. But this is, again, another way of bringing the knowledge in a more accessible way to a lot of individuals that may not be able to spend enough resources to travel to a meeting to listen to a variety of issues. So I think it's a wonderful and bright idea, and I wish I knew about it earlier.
A little bit surprised. Thank you very much. It was an honor to interview you, and you can follow us on Endovascular TV. Thank
Thank
you very
you.
much.